Okay. Greetings. I'm here to present a project that was funded by the Thompson Center on Public Leadership called the Milwaukee Reentry Alliance. I'm going to be presenting to you my findings from the 2018-19 funding year. My name is David Pate. I'm an associate professor and chair of the social work department at the University of Wisconsin-Milwaukee. It is my intention to discuss with you in this project the goals of the research, the methodology and analysis that was used, a brief overview of the results that we were able to receive from this project, and some implications of our research for future public policy that we hope to implement hopefully in the future. I want to be sure to mention all of the people who are a part of this project. This project is not just single. I'm not the only one who's doing this project, but this project is a collaboration of many agencies in the city of Milwaukee. My main partner is Employee Milwaukee, who served as my co-researcher in this project. Again, there's many other entities who were involved, from the Center for Self-Sufficiency, Project Return, the Alma Center, Department of Corrections, the Justice Council, Justice Point. We just had many people who were very involved and wanted to see how could we look at this whole issue of reentry and also better providing services for those who are being released from prison. It's important I think, before we start to even get further into the project, to talk about what I would consider a situational analysis. If you did not know, Wisconsin has a very high rate of incarceration amongst Black men. We were very concerned about the health disparities, that being physical and mental health disparities that were confronting these men as they really were released from prison, but also in their ability to maintain their self-sufficiency as well as their ability to maintain their own livelihood. We looked somewhat at rural versus urban economics and how does that really play itself out, even though we're primarily going to be focusing on, or we were focusing on primarily those in the urban environment, that being the city of Milwaukee. We were trying to understand too, what were some of the rural implications for those who were rural citizens as well. We also thought it was important to examine what we thought was a problem or an issue, and that is silos in terms of how people work when people are released from prison and coming back to the city or coming back to their home. So we were looking at what were the current linkages between unconnected work, Department of Labor, Department of Justice. How were they really trying to provide reentry services for those who were coming back from prison, and whether or not this is something that we could do a better job of. So this project allowed us to really do a lot of examinations and really to get a lot of voices on what this project could do in the future. And finally, reentry is definitely emerging or is being seen more as a purple issue. On both sides of the parties, many people are interested in how do we find a way to allow people who have been in prison to be able to come back. They've done their due diligence of serving their time and rehabilitating themselves, which is some hope of rehabilitation, for them to be able to now be what we will see a tax-paying citizen who is now being able to fully involve themselves in societal day-to-day situations. So we were really interested in a public policy discourse on the impact of public health, the economy, and safety, of course, is a major issue as well. So in terms of a situational analysis, we were looking at all of these three issues kind of as an overriding issue, but also want to see how could we, with this particular funding, really gain some information as to how could we move forward to hopefully a bigger project as well. So with every project that I do, and particularly in qualitative work, which is what this project primarily was doing, was qualitative research. So there's always this question of, so what? Why do this? We have done, there's been many projects or several projects that have examined the whole issue of reentry. But the unique part of this project was that there has not been someone who is going to be doing more of an organizational analysis, a service analysis, and then within the context of doing that service analysis, really understanding whether or not the recipient of the service was getting the services that they were supposed to get, and whether or not the coordination of those services was really actualizing itself in a way that made the transition from incarceration back to the community much easier, and reduce the whole idea of recidivism. Recidivism is a major issue with a prison population. At least up to 60% of those who have been released from prison will go back to prison, and therefore It costs this country and this city and the county a lot more money to have someone in prison than to have them working day to day and paying taxes and contributing to society and not being seen as somewhat of a problem, was often how people will refer to this population. Some of the other bigger issues in Wisconsin in particular that made this project really important was that we have a very large achievement gap by race, and particularly in the city of Milwaukee compared to the state of Wisconsin. Five black children live in poverty in the city of Milwaukee, and this particular project was focused on black men who are returning from prison, and therefore we wanted to really understand how can we resolve some of the issues that are there. 50% of black men have been incarcerated during their prime working years in the city of Milwaukee, and that's why Milwaukee was the city that was pointed out as a place to do this research of interest. And we've had some of that triangulated and validated by Professor Mark Levine, who has done much work in the city of Milwaukee at the University of Wisconsin in Milwaukee. The very high poverty rate also contributes to why this is a really important issue to follow up on. And then also we're concerned about the intergenerational mobility, or the whole idea of concentrated poverty, and what are some of the problems that are associated with that topic as well. So again, we had also some very key indicators as to why we thought this would be a really interesting and important project, not just for those who are returning from prison, but for the well-being of the city of Milwaukee, but also for the state of Wisconsin. So when you look at the whole idea of this project, we were interested in what we would call an audit design phase, really just taking some inventory of what are the projects, how are these projects working, what services do they deliver, how do people access those services, what do people really need when they're immediately released from prison, and then what do they need once they've been a year out from prison? What are some of the things that really should be in place to maintain someone's ability to have a state of well-being and self-sufficiency that will not hopefully cause them to have recidivism as a part of their life and return back to prison. So for me as a researcher, it was important for me to also educate myself, but also to educate all the stakeholders and mobilize them, so we can understand what is the effect of a returning incarcerated citizens, what is the transition back to their community, what is the delivery mechanisms, what are the policies in place, and how do those systems really impact the quality of life of these individuals and their ability to achieve self-sufficiency. That was our main goal for this research, to really do what I would call a deep dive, to really interrogate what's working and not working, and also to provide some significant critique moving forward on what could be done better. So that the whole idea of costs for these services was really actualized in a way that made sense and was going to help move us all to a place where we were seeing that there was some outcomes and results of the current delivery of services that was beneficial to those who were returning home from prison. So that was a main issue for us as well. The other part of the other goal of this was to use this data to drive a realignment of the existing reentry services landscape, so that the risk need, or the whole idea of reducing risk, the whole idea of reducing recidivism, the whole idea of providing a more coordinated and collaborating way of providing services was going to be actualized. And of course, this was a big, tall order. We only had a year, or slightly less than a year, to do this work. But what it allowed us to do was to provide us some very eye-opening information on what are some of the issues that people were facing that we just didn't have we weren't aware of. And also to allow us to look at how do we move things forward in a way that is going to be helpful to the population. So method and analysis. This was a qualitative study, which I'm very appreciative of. Qualitative studies often don't get funded for projects like this. So this was a good opportunity to get voices of those who have experienced being incarcerated. We conducted focus groups of individuals who are returning home from prison. So people who were labeled as former prisoners, or people who have been incarcerated. We also talked with those who provided services. So we conducted many focus groups. That was our primary way of getting data, was to have focus groups. I had some descriptive data about the population that was available to me and I collected. And then I did content analysis. And for those who don't know, content analysis is an examination of the data that's collected. So for example, I may have 200 pages of data, narrative that someone I have gathered through the focus groups or through all the focus groups, and I read all 200 pages of that data, sometimes slightly more, generally it's like a lot more than that. And I will look for what are the major themes that are coming up from this narrative that I'm reading. What are people saying over repeatedly that's going to help me to understand what are the next steps to take in order to provide a policy suggestion, but also to provide information on what are some of the barriers or challenges or successes that have happened as a result of the current reentry activities and services that are available in the city of Milwaukee. So we thought at this point, at this stage of the research, it was really important to hear from those who deliver services, but also those who are the recipient of services, and also for me to understand much better, which was really important, to understand what policies are in place that may impact someone's ability to be able to be a person who is able to return to society, or return to the city of Milwaukee, or return home in a way that's not going to be more challenging. So when we look at the participants who were involved in our study, we had 4 focus groups. We were able to have 23 men. That was Black and white men, because we wanted to, even though we're very interested in Black men in particular, we decided midway through trying to recruit for this study, that was not going to be fully possible given the timeline of the funding and when we have to spend the money by, and we wanted to be attentive to what we were required to do by the Thompson Center. We decided to make our population much larger. So we had white, Black, and Latino men who participated in this study, which gave us a broader range of information around what are some of the unique challenges specific by race, but also what are the challenges for a population of people who have been incarcerated. The age range of those who participated were 26 to 60. They were in federal and county correctional facilities. Their average salary since they've been out of prison is less than $12,000 a year. And for the men who were participants in this study, the range of confinement was anywhere from a few months to 14 plus years. And for some of those who had a few months of confinement in a corrections facility, that may have been repeated confinement. So it may seem like for most of them, it was not their first time being incarcerated. Unfortunately, for some of them, it was a number of times they had been incarcerated. So that was the participant demographics. In terms of provider demographics, which we also were able to include in this work over a significant amount of time, that being those who came to a day-long meeting, but also those who were interviewed or talked to in separate meetings outside of that focus groups that we had. We had 19 agencies who were participating in our meeting. The total number in that group was 42. The primary service provider were males 32 to 75 years of age and African American. The average number of years they provided service was 13 years, and the range was anywhere from 4 years to 30 years. So we had a robust group of people who knew how to provide services, who knew this population, and several of them themselves had been incarcerated and now are providing services to those who were returning home from prison. The service areas of what they provided was employment and training, mental health services, clothing and housing services, substance abuse services, and legal aid was also represented, or legal services were provided as well. The number of people that collectively this group served over a 1-year period based on our data collected was over 9,000 people, well, basically 10,000 people you could say, but we were able to get that data as well. And the majority of people they worked with were a male population. We did have 2 service providers who provided services to primarily a female population, but they had also had some interaction with men based on parenting issues that may have been an issue for people who are returning home from prison. So therefore they would have involved the father, or they themselves, based on their clientele, would often talk to the men about other issues as well. Some of the primary themes which were interesting that came up from this particular work, particularly with the participant population, was issues of survival. We'll talk more about all of these themes in the next few slides, but issues of survival, an issue of surveillance. What does it mean once you get out of prison? How is your behavior monitored or your activities monitored once you're released? What is their network of support once they are released? Do they have a network of support? What does a network of support mean if you are trying to be someone who's returning home? What role does capitalism play in their ability to get a job, maintain a job? Also, their definition of manhood comes into that whole idea of capitalism, because men are generally seen as the breadwinner or someone who's taking care of themselves and being independent. And that's not something that always is available to these men. The whole idea of relationships, that being either their partner relationships or relationships with their children or with their family members. And then also a big theme was the whole idea of their mental health state and the whole idea of reacclimating themselves back to society was a major concern for many of them as well. In terms of what some of the men told me, this is two of the quotes that I picked out. But the whole idea that people are stressed. One of the primary concerns for anybody is that if you need to figure out a way to be able to take care of yourself, in America in particular, you need to be able to take care of yourself, maintain a job, pay your bills, which everyone in this sample said they wanted to do. However, that gets to be much harder once you have been someone with a record. So that was a major issue, and I just took it there that we need to figure out how do we allow people to be able to really transition to a place where they're able to have employment. At the same time, this inability to have employment, or for example, one person talked about the whole idea they don't have a car. And you need a car to be able to work in a city like Milwaukee. The current system of being a bus, if you don't have a car, is not always reliable. There are many people who need a job in the city of Milwaukee, or other places outside of Milwaukee, and therefore, if you don't have a car, again, it's a big issue. So anyway, that got to be a major discussion with a lot of the men, but also the whole idea of their mental health of them. How do you navigate a system that you're not used to, or how do you navigate your own mental health when you're feeling like no one wants to see you as a person who is valuable to society? Housing was a major discussion, and primarily the biggest discussion point that we had throughout my focus groups. Many of these men cannot get an apartment or someplace to live because they don't have a down payment for security. Or they have a poor credit history, or they have, again, a record. There was some men who participated in this study who themselves have been seen as someone who had been a sexual offender, where the resources are just generally very small for them, and therefore they don't have many options at all. So that's the extreme. But those who are not labeled as a sexual offender still had some of the same major issues around how do I get housing? And housing, the lack of housing in recent research has been found, particularly by researcher Mara Curtis, who's at University of Wisconsin-Madison. There's lack of housing has a lot of mental health and health issues associated with it, and not knowing where you're going to sleep or how you're going to get to work, or how you have a place of sanctity and well-being has a lot of issues that go along with it, from public health issues to personal health issues. So that was a major one that came up amongst not just the participants but also the providers. The whole idea that people don't really know who they are, and that the one place of where surveillance and the maintenance of basically being someone who has to report in all of their behavior is their relationship with what someone would call the PO, is now the person who now has the title more like the community resource person. That can be problematic for some of them. It depends, and oftentimes it depends who you will get as your person of connection to as you go through your transition, or whether or not, as they will say, you're on paper, you have to report to someone. So connecting with someone who doesn't know you when you don't know them and hoping the relationship is going to be good can also be problematic for some of them in their transition back home. Again, this the surveillance thing was a big issue. One man talked about how one of his PO was punitive in the way that his wife was hospitalized. He was feeling stressed. He was not able to go to certain visits, and that put him in a space where he was more of a high risk. And so therefore we had a lot of conversations on, is there a way that we can figure out a policy or a practice where people are given a little more freedom, understanding that there may be a need for some people to have more of a surveillance on, but does that mean that everyone has to have that same type of surveillance? Some of the provider themes were, of course, the need for additional funds. And that was a big one. And that was something also, and it was interesting how the providers and the participants, in many ways, their themes overlapped. Some didn't. The surveillance part wasn't one that overlapped, but the idea that they need to have more services and more funds to be able to have an opportunity to transition in a way that made sense for them, because they're basically coming with zero income and oftentimes zero support, that they need more than less. There was also a concern about specific policies on the amount of time services are available. Oftentimes these services are not always available as often or as soon as people would like them to be, and therefore that can be problematic. There was again a discussion about improved relationships with probation officers, and then the biggest one that they brought up that this project was concerned about was coordination of services. So we were able to, in our own hypothesis, have an idea that it needed to be done better. But also, this was something that the providers brought up, that there needs to be someone who is looking at the system and allowing them to understand who does the job really well and who should be the primary provider of services, but also who could coordinate better in a way to provide these services. And the one thing about Milwaukee that is really good is that there's a number of initiatives organized through community advocates and others who are really who are not trying, but are having monthly conversations on what is going on around this population. So this project was funded at a time that was so ideal, because in the last 2 years, we've been able to do more work, and I'll again talk about that at the end, but we've been able to take this grant and make it to something much bigger based on the preliminary work we were able to do. Access to services was a big one, as I said earlier. And the one thing that many people talked about was that there should be more pre-release preparation. So before someone is about to be released from prison, there should be a way that they know what services are available. That should be almost a requirement of every place that there is where there is people who are about to be released from prison. And there should be programs that are allowed to go in and provide those services. Of course, in a time like this during COVID, that makes it much harder. But prior to COVID, when this study was conducted, there was this discussion around having people go in and be released. Before they were released, have a list of services, but not just a list of services, but someone make a contact and knew there was someone who was going to be able to support them through that transition back to society. Also, the idea of readiness came up through providers, saying that oftentimes people are just not always ready to receive the services. So time could be a barrier, because oftentimes their PO is saying you have to do something immediately, where they themselves are not necessarily in a state of a mental health state as well as a physical state to be able to do something right away. So it's this whole idea of readiness was an issue that came up. Now, how you deal with that is something I think we're exploring today, and we're going to explore for a couple of years. But the whole idea that many people are coming back to a place where reentry is not real for some of them, and so they need to have an opportunity, if at all possible, to have resources such as, for many of them, if we were to revert back to an old policy called general assistance, these men would be recipients, where there was some funding, where they would receive some kind of cash benefit, they would receive some other types of benefits. But again, that's a bigger societal discussion. So that way people would have, and again, with the general assistance program, uh, they would be able to have some money, so a job was not be their main concern, but a whole idea of getting reacclimated to society would be a concern. But again, that's something that can be a future policy discussion, to see whether or not we can do something like that in the future. Many of the people said that they were coming back to an institution or a place where they didn't have always the access and knowledge of services, and providers said what they would do, and they've done a really good job of doing job fairs or doing info resource fairs in prison, so that people know that when they come back to the city, this is what's available to them, and they needed more time and availability to do that. Oftentimes, because they're short-staffed, they don't have a lot of resources themselves. They're not always able to do that. And so they have been increasing their efforts, as I've seen them as a movement in Milwaukee, to do more of that. But that the whole idea of letting people know that people know they're coming back home and people know who they can connect makes a big difference. Challenges to delivery of services. We did have a group of men who again had sex offense as their crimes. Again, that's on the far extreme. And we learned from this project that in order to, you really can't work with a sex offense population and a general population of those who have been incarcerated. It's two different entities. This project really illuminated how we have a lot of different challenges depending on what the person's crime or charge has been, for why they went to prison. So again, the challenges to delivery of services is that for those who have been seen as a sex offender, there's basically little to nothing for them, and those who have been seen with committing other crimes, for a more general population of crimes, there's services, but again, the idea of how do you provide those services is getting more of a challenge when funding is being cut or funding is limited for this population. Um, some of the obstacles that were brought up is people don't show up. That's a big barrier because they often don't know how to shoot, how and when to show up. They get frustrated because they don't have the service readily available to them. And again, because people work in silos, that gets to be a big issue. And what this project has really illuminated and really solidified and really put a signature on is that we need to figure out how to collaborate. We need to figure out how to get out of our silos, because funding is limited. That doesn't mean that we couldn't do a better job at using those resources in a way that really helps this population. And it's also a public health issue more than anything, in terms of social determinants of health, as to what are some of the reasons why people morbidity and mortality is compromised based on the fact that they have been incarcerated. And there's been significant studies that have been done by Bruce Western as well as Reuben Miller at University of Chicago and Bruce Western at Columbia, have shown up recently that there needs to be more coordination, not just in a city like Milwaukee, but nationally. And they're doing work in Chicago and Boston that has shown that as well. So after all this learning and all this knowledge we gained, we were able to submit a grant to the Wisconsin Partnership, which is based at University of Wisconsin-Madison as well. And we are now, based on the work that we learned from this project, we were awarded a 5-year $1 million grant, because this particular grant was able to provide us information around what were some of the policy and practice implications that we need to work on and work on over some time period. So our goals right now are to improve or implement required pre-release programs. We're looking to improve access to job readiness and employment programs as well, since many men are definitely eager to work, feel like they're being a contributing member of society, and therefore wanting to do that. We're trying to really work on in a major way improving coordination and collaboration of social service providers and the correction system. So we're working with a number of groups, as we saw earlier, and we're still working with those groups and have expanded our work group. We're looking at improving the efficiency of delivering reentry services. And lastly, one of the major policies that we're really trying to do is increase access to health services. And that's health services in a broad sense, not just physical health, but mental health services for this population. So we're very optimistic about the work we're about to do. We're currently engaging in the beginnings of our new project, thanks to the funding that we received from this project here, that allowed us to have a significant amount of information as to how to improve the outcome and well-being for those who have been incarcerated. Thank you.